Good afternoon. My name is Corina Herrera Loera, Public Information Officer for the Santa Clara County Emergency Operations Center. We're happy to be back at our community forum here in conversation with the county. We have an amazing guest coming up, but before that, I'm going to give an update as to where our county currently stands with COVID-19 and vaccines. If we can go to the next page. So as you all are aware, and I continue to report, that the cases in our county, although our numbers in total have gone down in regards to the COVID-19 cases, which allows us to open up more, I do want to highlight that Latinos continue to be the highest population that make up most of the COVID-19 cases in our county. Even though we are not the highest population in our county. Next slide, please. And so, also in regards to the vaccinated residents in our county, as we all know, we are very proud that within the entire county, we're at 77.8% of those who have received at least one dose. However, within our Hispanic and Latino community, it should be noted that only 55.1% of our community has been vaccinated. Even though as an entire county, we do have a large number, we still have not vaccinated. And if you can see on the chart here, where it breaks it down on the demographics, our community continues to be the lowest number that's been vaccinated. Next slide, please. And so just a reminder that all individuals in our county ages 12 and older are currently eligible for a vaccine. And actually, I did say within our county, we are opening it up to all individuals in ages 12 and older are eligible for a vaccine. So just a reminder to visit sccfreevax.org to make an appointment, or you can also call 211 to schedule your appointments. Next slide. And so these are the locations this week with multiple drop-in days. We have the Fairgrounds Expo Hall. We have Eastridge Mall with the times and dates there. We have Emmanuel Baptist Church, and we have Conexión. And before we go to the next slide, I do want to highlight that some of our sites on this page, even though we will continue to provide vaccines at the fairgrounds, the times may change, and so please make a note there, and locations maybe. So just take a note there, Fairgrounds, Gate D, and then the specific times and dates. And then Emmanuel Baptist Church will continue. Conexión is, I do want to highlight, only one day, Thursday, June 10th, from 10 to 5:30 p.m. Thank you. Next slide. And then we have the Mexican Heritage Plaza, Gilroy High School, Overfelt High School, and Valley Health Center of East Valley. I do want to highlight on this page that Gilroy High School will be closing on July 8th is the date that I have. So I do want to highlight that if you live in Gilroy and that is the closest place to you, and if you haven't gotten your appointment yet or haven't gotten vaccinated, please make sure to go this week. It will be open Wednesday through Friday, 8:30 a.m. to 3:30 p.m. And or you can make your appointment through the sccfreevax.org. Thank you. Next slide. And then just to highlight some of the information I already mentioned and the new information. So the Fairgrounds Expo Hall will remain open. And then the site at Berger, that one will close up on June 11th. And then the nearest site there will be the Fairgrounds. And then Levi Stadium will be closing on June 24th. In regards to those who need a second dose, we are shifting those to go to the Fairgrounds. And like I mentioned on Gilroy High School, that will close on July 8th. And those who plan to get the second dose, or those who still need a second dose after that date, will be going to VHC in Gilroy. And then Mountain View, the community center, we don't have a closing date, but there is a plan there to send anyone getting the second dose at VHC in Sunnyvale. But please take a note of that. If you haven't made your appointment yet, if you haven't gone, please make sure to go before those dates. Thank you. Next slide. And just a reminder to continue to follow these core principles to stay safe, get vaccinated, stay masked, maintain a 6 feet distance from others, avoid crowds, stay outdoors, get tested, especially if you are a frontline worker or exposed to the public. So just reminders to continue to be safe. Next slide, please. And I do want to highlight a special event that we have going on tomorrow at the PayPal Park, which is where the Earthquakes play. We have a vaccine event with Alanis Fierro, Chofis, and more. And my understanding, for those of you that are Chivas fans out there, they do play with Chivas and are here in our local San Jose community, so you can get an autograph from them. There will be food, activities for the entire family. So tomorrow night, between 4 and 7:30, take your family, get some goodies, get an autograph, get to know these amazing players that are here currently in San Jose, and also get your vaccine. And so some people have asked, if I already have my vaccine, can I go? Yes, you can come, and to be able to be a part of this, what we're asking is that at least one of your family members gets the vaccine. So we're encouraging folks to, make sure they get their vaccine and also have fun at the same time. So come out with your family. Make sure that those of you who don't have a vaccine yet get it. And if all of you have it, bring a friend who maybe hasn't gotten their vaccine, bring their family too, and make it a big family event. And get your vaccines, especially now that we've opened it up to the 12 and older. Next slide, please. And so I just want to highlight, I know 2 weeks ago, we had to reschedule our community forum with the unfortunate happenings of the shooting there at VTA, which I want to highlight that we continue to keep the families and those affected and the victims in our prayers and send our condolences. A very tough day, and continues to be a tough time here in our community. But we are San Jose Strong, and we'll continue to move forward, supporting one another. And so I did want to highlight some of the things that we're going to be focused on that day that weren't today. And so in regards to the yellow tier, some people still might not understand where we've been, where we're going. We also know that there's going to be some possible changes, what we hear as of June 15th, that the governor will be highlighting. And so we just did not want to miss this day. I know some of you were asking, well, what's the updates going to be if, we hear the June 15th? We want to make sure that we mark this day, since we promise our community that we are having our community forums every other week, with at least the updates that we have up until now. So in regards to the yellow tier that we entered, as you all know, and have been on for some time now, the changes include maximizing telework is no longer required by businesses. Social distancing protocols are no longer required. The local mandatory directive on capacity limitations has been eliminated, and the local capacity limitations have been eliminated. So if you have any specific questions around that or want to see the details, you can go to the Blueprint for a Safer Economy and Industry Guidance to Reduce Risk for additional information. Next slide, please. And also some of the changes include requiring employers to collect information about their employees' vaccination status. Employees will choose from the following options. I am fully vaccinated. I received my second dose of Pfizer or Moderna vaccine, or my single dose of Johnson & Johnson vaccine less than 2 weeks ago. I received my first dose of Moderna or Pfizer and my second appointment is scheduled, or I have not yet been vaccinated, but I have already scheduled an appointment to receive my first dose of vaccine. I have not been vaccinated, or I decline to answer whether I have been vaccinated. And so those are some of the changes and some of the things that some of us have already seen from our employers who have taken that information in already and get to update that after a certain time. And we'll hear a little bit more in the rest of our community forum today. And if any of you have any questions, feel free to put them in as we're talking and updating so that we can make sure to answer your questions. Next slide, please. And so, as I mentioned, 2 weeks ago, unfortunately, we had that tragic incident in our city. We were getting through this pandemic. We're near the end, but our community has gone through a lot in this past year and a half, in these past 2 weeks. And so it's been tough. We wanted to highlight some of the resources that might be helpful to you and or your family. So the COVID support line, 808-7770, and that's for any questions regarding COVID. I'm going to highlight just a few on here. The mental health services number, the 1-800-704-0900. Also the crisis hotline 24/7. So you can call that number any time of the day. And that's 1-855-278-4204. Or those of you who prefer to text, you can text renew to 741-741. Thank you. Next. And just reminders of phone numbers to make your appointment to get your vaccination. Any questions regarding COVID, call center 211. Or you can call 408-970-2999, and you will get help in any language that we provide here. And then also, again, for those of you who prefer to text, you can text the message COVID-19 to 211-211 for any questions you might have. Next slide. Great, thank you so much. And now, as I mentioned, we have an amazing guest who's been with us before. Some of you who have joined us in the past will remember her. We have Ruth Silver Tom, and she is the Employment Law Supervising Attorney at Step Forward Foundation and the Catherine and George Alexander Community Law Center at Santa Clara University School of Law. She also supervises the Santa Clara County Office of Labor Standards Enforcement Legal Advice Line. So thank you so much, Ruth, for being here. Now I'm going to turn it over to you. And in the meantime, write down your questions. I'm going to be gathering and then facilitating a question and answer period after her wonderful presentation. Thank you.
Thank you so much. Next slide. So I am going to talk a little bit about the laws around vaccination, and I've organized it so I'm going to talk about the OSHA standards and the standards that the EOC and DFEH have. Now, the EOC is the agency, the federal agency, which is charged with enforcement of discrimination laws. And the DFEH is the state agency that is charged with enforcement of discrimination laws. So OSHA came out with a revised emergency temporary standard. It is going to change again, but as you heard, as of this moment, this is the law. If you're indoors and you're fully vaccinated without COVID-19 symptoms, you don't need to wear face coverings in a room where everyone is fully vaccinated and doesn't show symptoms. However, if there's a mixture of vaccinated and unvaccinated people, everybody has to wear a mask. Outdoors, if you're fully vaccinated without symptoms, you don't have to wear a mask. However, if you're not fully vaccinated and you're outdoors, you have to wear a mask and you have to stay 6 feet apart. Next slide, please. So employers can eliminate physical distancing and barriers for workers indoors and outdoors at mega events, but they have to provide N95 masks or respirators to everybody who's unvaccinated for voluntary use. And after July 31st, there's no more barriers, but employers must provide all unvaccinated workers with N95s for voluntary use. Next slide. The prevention trainings must include information on how the vaccine is effective and protects against transmissions and serious illness. And fully vaccinated workers who don't have COVID symptoms no longer need to be excluded from the workplace. In other words, you don't have to quarantine if you're fully vaccinated and you don't have symptoms, even if you've been in close contact. So the next one is the state law. From the Department of Fair Employment and Housing. And there's been a lot of questions about mandatory vaccines. Can the employer force you to get a vaccine? Next slide, please. Next slide, please. So, yes, mandatory vaccination policies and practices are allowed. So the employer can force you to get a vaccine if the employer wants you to keep working, but the employer can't discriminate. And what that boils down to is if you're not having a vaccine because you have a disability or some reaction, serious reaction to the first vaccine, and the doctor said don't get another one, or if your religion, that is strongly held belief that is that comes under the religious classification, if that prohibits you from having a vaccine, the employer is not allowed to discriminate. So this is on the next slide how it works. With disabilities, employers are required to reasonably accommodate you if they know you have a disability. So if you object to the vaccine on the basis that you have a disability that prevents you from being vaccinated, the employer has to have a dialogue with you. Legally, it's called enter into or engage in the interactive process. Basically, talk to you, have a dialogue with you, and accommodate you. And those accommodations, these are just some examples: working from home or implementing safeguards at the work site so that you won't endanger other employees. So the next slide deals with that religious accommodation that I talked about. So employers have to reasonably accommodate employees' known sincerely held religious beliefs and practices. So if you're objecting to vaccination on the basis that you have a sincerely held religious belief or practice that prevents you from being vaccinated, again, the employer can't just say no. They have to engage in an interactive process, which is talking to you, having a dialogue, and then reasonably accommodate you. And that could be job restructuring or job assignment. Now, next slide. So basically, if you don't have a disability or sincerely held belief or practice, the employer does not have to accommodate you at all. And employers can discipline you, use reasonable disciplinary policies and practices if you resist getting or you won't get vaccinated, and the reason is unrelated to disability or your sincerely held religious belief and practice. But this is very important. The employer cannot discipline you because you request an accommodation. So let's say you request an accommodation and you say, my religion, prohibits it, or I am disabled and you need to accommodate me, even if it's later determined that no, those aren't good reasons. In your particular case, you can't be disciplined for asking for an accommodation. So that's really important. So the next slide deals with the questions that an employer can ask you. So employers can generally ask you when you're entering the work site whether you have symptoms. If they have a mandatory program, let's say they require you to have vaccinations to work, they can ask certain pre-vaccination screening questions that can elicit information, but they have to be job related and consistent with business necessity. They can't just ask you a lot of invasive questions, but they could ask whether you have a fever or something like that about your symptoms. And this is also very important. They have to keep any records of vaccination confidential because they're confidential medical records. So the next laws we have to look at are the federal laws, which are the ADA, Americans with Disability Act, and the Genetic Information Non-Discrimination Act. That has to do with some genetic conditions or something about your genetic makeup that the employer might use to discriminate against you. So what does the EEOC say about inquiries about vaccination? Well, next slide. The employers are legally allowed to ask about or require proof of vaccination. So that's the same federal and state. And this is what the EEOC said. There's no indication that there's any federal law that would be violated by the employer asking this question. Have you been vaccinated? And also, according to the EEOC, there wouldn't be any violation of their laws as long as they were careful about what vaccination-related questions they ask. So they give an example that a possible violation might be if an employer asks you why you didn't get a vaccination. So if they ask you why, they can ask you, did you get one? And you say no. But if they ask you why, it could be because you have a disability, and that could elicit information about the disability. So the next slide. So this is something that really bothers me. Every time I read, this can't happen because of HIPAA. So does HIPAA prohibit the employer from asking about my vaccine status? That's the question that I've had asked. HIPAA only applies to healthcare providers. It does not apply to employers. It doesn't apply to your restaurants, grocery stores, friends, anything. It's just healthcare providers. HIPAA only applies to specific health-related entities such as insurance providers, healthcare clearinghouses, and healthcare providers. They are not allowed to disclose your medical information. That means that even if your friend, favorite restaurant, grocery store were to publicly share private details about your health, they would not be violating HIPAA. There may be some other laws, but not HIPAA. But under the Americans with Disabilities Act, the employer cannot share your health information. So they're right that the employer can't share your health information, but it is not because of HIPAA. The ADA, Americans with Disability Act, has a confidentiality of medical information provision. Next slide. So you heard something about Santa Clara County already. So there was this May 18th, 2021 directive, health order that came out. And it does allow employers, and we could see that this is consistent with state and federal law, to determine the vaccination status of employees. And it's not just employees, it's contractors, interns, volunteers, even gig workers who work on site. So as of January 1st, the employer in our county was allowed to ask that question. And the employers may keep a record reflecting each person's vaccination status and simply document the employer's review of either the vaccine card, or you saw the certification earlier with the questions on it, or that form. But there also is confidentiality here, not because of HIPAA, but it is in this law too, as well as the ADA, that employers must treat this information confidentially, and they have to keep these records as long as the order is in place. Next slide. So the order requires all persons, regardless of vaccine status, to wear face coverings in the workplace. As you heard, things are in flux. It may change by June 15th. And as you also heard, employers are no longer required to maximize telework or submit social distancing protocols, and there's no mandatory directive on capacity limitations. Now, employees who decline, next slide, to provide vaccination status. No one's forcing you so far to get a vaccine, according to this directive. If you decline to provide your status, let's say you don't want to tell them. If you don't want to tell them, then you are presumed to be unvaccinated. And that's true according to these other laws too. If you're not going to tell them or show them, then you're presumed to be unvaccinated. And under this law or this order, employers must ask workers who are unvaccinated or who decline to disclose their status for an updated status every 14 days, June 15th, 29, July 31st, and document their status. And now people were asking, is this only for workers that are working on site? What if you are still teleworking or working remotely? Well, this directive does require people who work on site to disclose their vaccination status, but it strongly encourages determining the vaccination status of people, everyone, even people who are working remotely. It doesn't mandate it, but it says we strongly recommend. And businesses that fail to comply are subject to enforcement, may be required to pay fines up to $5,000 per violation per week. So next slide, unvaccinated workers. All employers must provide information on how to get vaccinated to all personnel not vaccinated, even if you're remote, working on site remote. And if you're not fully vaccinated and you're in close contact to a confirmed case, you can be, you must be. So if you're not vaccinated and you're in close contact to someone who has COVID, you must be excluded from the workplace. In other words, you must quarantine for the duration of the applicable quarantine or isolation periods. So basically, if you aren't fully vaccinated, in other words, let's say you just had one vaccine and it was Moderna or Pfizer, you didn't get the second one. If you're in close contact, which is 6 feet distance for over 15 minutes, and the person you were in close contact with has COVID, then you have to be excluded from the workplace. So I'm now pivoting to the sick leave. Next slide. So we still have in effect the supplemental state sick leave policy. And that was enacted March 29th. So if there's 26 or more employees where you work, and you can't work because of illness or exposure to COVID or vaccination and recovery. And I do want to point out that it's not anticipatory. In other words, I'm getting my second vaccine. Everyone else gets sick. I'm sure I'll get sick. So I'm asking for the day off. No, you have to actually have a fever, chills, whatever symptoms make it so you can't work. But you do get pay for vaccination and recovery. Also, if you're caring for family members who have COVID, or if the school is closed or there's a quarantine because of COVID exposure on the premises. So your kid was in school or you're a teacher and you were actually exposed to COVID, you need to quarantine or you have symptoms. And this goes back to January 1st, 2021. So if you took off work because of any of these reasons, between January 1st and March 29th even, you are still covered. After March 29th, you're covered, obviously. Before that, you're still covered, and they cannot force you to take your sick days or vacation or any sick leave you have. So if you used it, you can, get that back. So that's really, really important. And the next is California paid sick leave and the San Jose. So everybody, most people know, we all get 3 days paid sick leave per year. You accrue it 1 hour at a time, up to 1 hour, for each 30 hours you work. So every time you work 30 hours, you get 1 hour of sick pay, up to 3. You can accumulate another 3 but you have to use it the next year. Sometimes the employer can just give it to you up front. If they choose to do that, they could do it. Or you could accrue it or accumulate it or have it at this 1 hour for each 30 hours you work. Now, check your pay stub, because there's big penalties if the employer does not put on the pay stub how many hours you have left of your sick leave, of this sick pay. Also, that supplemental pay I mentioned, the 80 hours if there's 26 or more employees, that has to be separately on your pay stub too, so you know how much you have left. So now San Jose has a sick pay too for COVID. But it's only if you work in San Jose, and it is actually ending at the end of June. So you want to make sure, that that it's going away. They may extend it. I don't know, but and you should watch out for that to see if they extend it. But right now, it's if you're COVID positive, if you've been exposed, if you have symptoms and are seeking a diagnosis, or you have to stay home to take care of a child because the school is closed. So next slide. So even though OSHA has revised some of its directives and rules, it still has, they call it exclusion pay. It's basically if you need to quarantine, that's what it means. So the first question is, must an employer pay an employee while the employee must quarantine and has no symptoms? If you have to quarantine and you have no symptoms, the employer does have to pay you if you acquired COVID at work. So this is if it was at work, because OSHA deals with health and safety at work. Now, if you got COVID at work and you need to quarantine and you do have symptoms, then if there's 26 or more people, you can use that supplemental sick pay. You can use your 3 days pay, and you need to use those. But after that, you would have to apply for workers' comp. And let's say you do apply for workers' comp and your employer does not believe you that you caught it at work. Well, you get your number from workers' comp, the claim number, and then you apply for state disability while they're trying to figure out what they're going to do about that objection by the employer that you didn't get it at work, and you can get state disability. So there's a question on the state disability form, did you get, is this work related? You're going to say yes. And then there'll be a pop up which will ask you what your claim number is for workers' comp. Normally, if you say it's work related and you didn't apply for workers' comp, you won't get state disability. You need to have that number. Okay. So then there's another law that was in effect because employers weren't telling next slide, employees when they were exposed to COVID, they weren't telling them what sanitation measures they were using. So this law got signed by the governor, and it says the employer, if the employer receives notice of a potential exposure to COVID, they have to tell the employees within 1 business day, because people were hearing it from word of mouth. Also, the employer is supposed to tell you about the benefits and options. In other words, the supplemental sick pay, state disability, whatever you could get while you're out of work. There's also laws, sick leave laws too. I mean, disability laws. Let's say you have long COVID. Well, as long as there's 5 employees, you've worked there a year, you work at least 25 hours, you can get a leave of absence, a medical one, for up to 12 weeks. And during that time, you get state disability. But even if you haven't worked there a year, you could still get the time off as a reasonable accommodation under the disability laws, and then you can get state disability. So the employer needs to inform you of all of your benefits and options. And also, the employer has to tell you about their disinfection and safety plan. So that's really important, because a lot of times I get calls and people say, I knew, I don't think they're cleaning up, or they're using the same janitorial service and there was a cluster of COVID cases. So they have to tell you what they're doing to sanitize. So the next slide, and I think hopefully all of you know this, the county will provide transportation to and from a hotel, pay for a motel or a hotel, provide 3 meals a day, laundry, and pay if you can't quarantine at home. And that's for lower income people. And also, let's say you can stay home, they'll shop for your groceries, provide cleaning supplies if you can quarantine at home. And the referral hotline, it's 7 days a week, 8 to 5. And you heard this number, but I'm just repeating it, 408-808-7770 to make a referral. So the next slide is our legal advice line. So we have an advice line, and it is in a number of languages. So you would call. This is for both employers and employees. We do get employers calling with questions, employees, and we're all employment law attorneys. And line 1 is me, that's English. Line 2 is Spanish. You're going to be hearing from Daniel Menendez at 4 o'clock, a presentation in Spanish, and he's on the Spanish line, as well as another attorney, Hector. There's also the Vietnamese line. Zwin is on that. And then we have a Tagalog and Visayan line, Fawina. And then we have a Mandarin line, that's Ming. And then we have a Punjabi and Hindi line, and that's Shalini. So that's our legal advice line. And we answer any workplace related questions, any legal questions regarding your rights at work if you're an employee, and your obligations at work if you in the workplace if you're an employer. And we're always happy to speak with you. I do want to say we also file public health complaints, and those complaints can be anonymous. So if you don't feel comfortable, you have actually 3 options. One is anonymous. The other is private. And what that means is that you leave your email address. Only the county will know that. They're not going to share it with the employer, but they will tell you when they've concluded the investigation or any other information that they're able to provide to you. And then the last one is open, where you give all your information and you have no problem with the workplace. And it's not just a workplace that you can report. If you want to, you can report, your church, a grocery store, if you see something, a business, whatever violation you see, you can report. I think that's the last slide. Yes. Thank you.
Wow. Thank you so much, Ruth, for all the wonderful information. How blessed we are in our county to have you as one of our legal advisors. You all heard the phone number, and she even, said, I answered the one on number one, line number one. So you all have it. You can always rewind this video later and jot down that number or write it down now, and or let anybody that might need the service and resource know. And so now we're going to move over to our Q&A session, and just want to remind our public, our audience, that if you have any questions for Ruth, remember, she is an attorney. She is here to answer questions. And so let's take advantage of this time with her. We're blessed to have her here answering any questions. So I'm going to kind of go down the comments and questions as I see them. Thank you so much for all of you who are tuning in. And I'll go ahead and just go down the list. We have Ava Chow, who says, hello, Karina. Hi, Corina. Hi, Ava. Good to see you. Thank you for tuning in. We have David Sampson, who mentions, and I'm going to kind of summarize some of them because I was able to review while Ruth was speaking. So he's concerned about certain businesses not requiring masks after the June 15th, and how to shop with toddlers. So there's not too much of a question there, just more of a comment. Thank you, David, for tuning in. And then we have Spencer Anthony Howell, who appears to be anti-vax, and we respect everybody's thoughts. And so thank you for also tuning in. And then we have our next person on here, Kathleen Ways, who suggested to the person before, to David, about shopping online, but those stores have the ones that have delivery. So thank you for tuning in, Kathleen. And then we have David Sampson, again, who understandably, states that children shouldn't have to stay home. So such a difficult time, right? For those of us who have children who are not even of age to be vaccinated. And so thank you for tuning in. As a parent, I can relate to you. And then we have Girish Narang, who asks about data regarding the percentage of people who are contracting COVID and hospitalized in spite of having vaccine. So I don't have that offhand with me, but I will look into that, and at our next community forum, hopefully have an update with you regarding data on that. Thank you for your question and being here. And then we have Ken, who also has his thoughts around, not very clear, but I'm assuming some of the presentation that was done today. Thank you, Ken, for tuning in. We have Girish Narang, who says, are employers exempt from lawsuits if employee contracts COVID that can be traced to their facility? So Ruth, I'm gonna repeat the question. This one's for you. Are employers exempt from lawsuits if employees contract COVID that can be traced to their facility?
Workers' compensation covers any injury or illness from work. So the employee could file a workers' comp claim. They couldn't sue in court. If there's a third party, they can always sue the third party. But with COVID, if they just caught it from work, they could file a workers' comp claim. In certain cases, workers' comp has a presumption of certain workers, healthcare workers, that they did catch it at work. With others, there's more proof. It's more difficult. And as I said, employers pay into workers' comp. If they don't have workers' comp, they can get in trouble and have big penalties. But there's also an uninsured fund as well. If an employer doesn't carry workers' comp, it's also a crime not to. But it would be just, they pay their comp premiums. They pay them just like they pay into unemployment, they pay into workers' comp. Employees pay into state disability and paid family leave, but they pay into that. And if there were a claim, then their workers' comp carrier would handle it. But there's no exemption for employers if people contracted on the facility. I think you might be thinking about these vaccine manufacturers and whether, if there's some injury, if they can be sued, but that's different. That's not the same as workplace.
Thank you, Ruth. And I will be focusing on questions regarding today's presentation. I do see some questions around summer camp, etc. So we'll get back to you on that individually. So I'm going to go on to John Boucher's comment here. In a business where customers are present, do all employees need to wear a mask because the vaccination status of customers cannot be determined? And so I don't know, Ruth, if that's an answer that or I know things are going to change. So do you have a definite answer for now? If not, we can come back with an answer to John.
I think that's a good question. All of these laws right now deal with whether all of the employees have been vaccinated. The county, you still have to wear masks. The OSHA rule is that if all of the employees are vaccinated, you don't. But I certainly think that it would be wise to wear a mask if you don't know the status of the customers.
Absolutely. Thank you. Thank you, John, for joining us. We have John Ali, who also joined us. Thank you. We have Eric Sanj, who stated good presentation, Ruth, as you were presenting. So just wanted to highlight that. Honor your time here. Thank you. And we have Micah Williams, who appears to be for the vax. And again, I want to focus and honor Ruth's time here. So I want to focus on questions to her. Chris Gianetto, will Santa Clara County be fully open on June 15th? And I think that's a question we all have, right?
We don't know. Yes.
Yes. So we will be getting a directive from the governor, from the state. And we will see what happens on June 15th. That's a magic date that we're all waiting on. Thank you, Chris, for joining us. We have my DFAM, who stated great presentation, Ruth Silver Tom. Thank you again, Ruth.
I do want to say that Mai is a wonderful attorney and someone I deeply respect. And we partner with VABank and also with my fan in her office to hold clinics, at least before COVID, in the community for Vietnamese Americans. And she does great work. She's an excellent attorney. They have immigration and family law.
Awesome. Thank you, Mai, for your work. And thank you, Ruth, for giving that very important shout out. And then we have Mary Jensen, who stated, our children under 11 and are not vaccinated yet. How do we keep them safe? And for some of us that are parents of children under 11, I think there was a suggestion, on top, but really, I think, as just wearing my parent hat, right, which is part of the reason why I will continue to wear my mask, and hopefully do my best to encourage those folks around me, especially my family who I spend time with, to get vaccinated so that we can be safe. But that's a very good question. I'm going to also take it back to our management and see if there's some sort of guidance that we can come back with on behalf of the Santa Clara County. And then we have, thank you, Mary, for joining us, Laura Martino, who states, as a sole proprietor leasing a space in a salon, it is my responsibility or the owners to report vaccination status. Ruth?
So if you're a sole proprietor and you're leasing a salon, then if you make your own appointments, which I assume you do, and the salon doesn't, if the salon does make appointments for you, then under AB5, you're an employee. But if you make your own appointments, you are a sole proprietor. And the law, the mandate says that contractors and gig workers and everybody need to be checked. You are an independent contractor and you are on the premises, and I would say that the owner could check it. You do not have to report any of this. The owner or you do not have to report any of this. You just keep those records yourself. The county, you're not having to report it to the county. But it is pretty broad. It's basically anybody who works there.
Thank you. And then T. Villarreal asking what will be the rules with masks to be determined. So I know.
Yeah, OSHA is meeting again, and they may change their rules too. And then after June 15th, there may be changes too. So, we're reluctant to say anything definitively. I don't see any changes in the employer's right to mandate vaccines, with the two exceptions, disability and religion. But in terms of, whether if everybody is vaccinated or unvaccinated, when you will be wearing masks, that may be different. I know with OSHA, what they thought was it would be just too difficult to determine who's vaccinated, who isn't. And so if anybody is unvaccinated, everybody should wear masks. Other rules, the county one is everyone should wear masks. But that may very well change on June 15th. So I'm happy to send updates after June 15th. And I'm hoping we have a little more certainty for a longer period of time. But we're all dealing with a very fluctuating situation.
Thank you, Ruth. And then we have Stephanie Schleifer, who says, how would you know if everyone in your meeting is vaccinated? Does the manager ask HR? I believe HR can't tell the manager. So can you really have an unmasked meeting knowing not everyone will be vaccinated in a large workplace?
Well, the employer will know, and HR will know, and they'll be allowed to, say everybody must wear masks. They're not disclosing who specifically is unvaccinated or vaccinated, but they will tell you. And as a matter of fact, if anybody is unvaccinated, according to the OSHA rule, then everybody has to wear masks all the time. And until June 15th, everybody has to wear masks anyway. So the view is that management will know, or the employer will know, and the employer will tell you whether you all have to wear masks or you don't all have to wear masks. Recently, we were flyering about the advice line and about vaccinations in Milpitas. And a lot of employers and employees were coming out and telling us, we're all vaccinated here. Everybody was very proud of that. And so, I like that. And I'm hoping we see more of that.
Mm-hmm. Yes. And we have TV Arel, who's saying, how are you going to control people that are not vaccinated and wearing masks? I think you mentioned it. I think we've also talked about it as a county. There's protocols in place for those who are not vaccinated. and the employer will then be following up on that, right? The employers will have a protocol for those that are not vaccinated and a different one for those that are vaccinated.
Yeah, the employers will either have you show your vaccination card or have you fill out that declaration where you're stating that you were vaccinated or not vaccinated. And the one big difference is that if you're exposed to COVID and you're vaccinated, you don't have to quarantine. But if you are unvaccinated, you do have to quarantine.
Thank you,
And
Ruth.
also there is that requirement under OSHA that the employer provide N95 masks as well in certain circumstances.
Okay. And we're doing pretty good. We have about 3.5 minutes left, and we have, I think, just 2 questions left. So here we go. Shell Lynn Dovins asks, what about restaurants? Do guests have to wear masks inside the restaurant still? Do employees, if they are vaccinated, have to wear a mask? Is it up to the owner?
Well, the employees, if they're vaccinated according to the OSHA laws, they don't, in this county, they still have to wear masks. And the guests, it would be up to the owner.
Okay. And then we have Carmen Castillo who asks, does this apply to small businesses too?
Yes, it applies to every business, every single business in the county, small, large, middle.
Great. So with that, I'm going to end with these next 2 comments. But before I do that, Ruth, I want to thank you so much for your time, for your expertise, for being a leader in our county and providing us with such important information today. So we do have Ava Chow who says, thanks for having a question and answer session. This is great to clarify any misconceptions. And then we have Tri Nguyen, who states Ruth is awesome. So on that note, I'm going to end today. Thank you again,
Ruth. Awesome himself. He's amazing. Vietnamese American Roundtable, and he does great work in the Fair Workplace Collaborative too. I can't say enough good things about him.
Thank you, Tri, and thank you all who joined us today, and those who provided questions, comments. And Ruth for answering all of them. We were able to get through all of them. So thank you again. And we hope to see you here again to be able to inform our community with the most updated information in the near future. With that, I don't know if you have any closing comments to close us out today. Thank you so much, Ruth. And thank you all for joining us. We'll see you in 2 weeks again here in Conversation with the County at 2:30. Every other Wednesday. Have a great 2 weeks, and we will see you then. Thank you, Ruth, again for joining us. Take care.
Thank you so much. It was a real privilege to be here.